was quick. And your contact details are still on the question and answer page, Roger at hypnosishealthinfo.com. That was a fantastic presentation, Roger. Thank you very much.
Well, thank you.
Yeah, and I'm just waiting for any questions to come up, which there are none right now. So if you'd like to type them in.
And as they're doing that, one of the reasons that I teach self-hypnosis, I teach mindfulness to my clients, is that it's truly as a way of them learning how to take control of themselves. And it's about them learning to use their own inner resources to be successful at their goals, so that they're not dependent upon me, they're not dependent upon listening to a CD or anything like that. It's using those internal resources to empower themselves, and learning that, yeah, they can lower their blood pressure. They can slow down their heart rate. They can boost their immune system.
I love that one. I really do love that one, the one that you can boost your immune system and lower your blood pressure as well. That's amazing, because it's literally starts with a thought.
It does, and there's some pretty fascinating studies. I do a lot of work with folks that are living with cancer, and there was a study, I think it was in 2007, that showed that women who were having breast cancer surgery, who had just one mindful hypnosis session prior to surgery, had required less anesthesia, less analgesia, had a shorter surgery, had a quicker recovery time, had less pain after surgery, and I forget what else was in there. But they figured the average savings, cost savings of that surgery was a little over $800 just from having one hypnosis session prior to surgery. That's what we can do with our unconscious mind or our subconscious mind is pretty phenomenal.
Yeah, you're not wrong. Now, it doesn't look like we have any questions, or it doesn't look like anyone's typing anything in, which I guess is okay, because either you got it or oh yeah, have you seen? Okay, Cherie asks a question. Have you seen results with people who are suffering from serious illness such as lung disease? Thank you very much for your question, Cherie.
Yes, and if you go to hypnosishealthinfo.com, and up in the orange menu bar you see the word health, and click on the cancer one, you'll see a testimonial there from a woman that she says, based on our work, she had a cancerous tumor shrink because of hypnosis. One of the things that I always tell folks is that you know, I'm not going to tell you that hypnosis is going to heal you. I don't talk about being healed or anything like that. What I talk about is lessening of the symptoms. And so lung diseases, depending on what, you know, whether it's asthma or some other lung disease or a cancer, whether or not they're healed, I don't know. But if we can lessen the symptoms, if we can lessen the pain and suffering, if we can even get 10% improvement, that's great success. And we want to build on those small successes, because some of my folks, you know, on a scale of 0 to 10, 10 being, you know, unbearable pain, and they're living at a 10, if we can get them to an 8 or a 9, in 10, 15 minutes or less, that's pretty remarkable for them, and ultimately get them down to sometimes down to a 0.5 or no discomfort at all. Sometimes they only get down to a 5. It just kind of depends on each situation. And like with my own issue of having rheumatoid arthritis, I would never say that I have been healed from rheumatoid arthritis. Quite honestly, I don't know. What I do know is I no longer have any of the symptoms of rheumatoid arthritis. And that's great for me, and that's the response I get from most of my clients, whether it's um, multiple sclerosis or Crohn's disease or lupus or any one of a number of diseases, illnesses. If they no longer have the symptoms or their symptoms have improved, they're very happy.
Thank you, Roger. We've got another 2 questions, and then we'll and up there. They're quite. The first question is from Rose. Thank you, Rose. And the question is, you said more intelligent people are more adept at hypnosis. Any further comments? Thank you.
Yeah, when people talk about they can't be hypnotized, what it really gets down to is a choice. And they can either choose to participate and play along and imagine, or they can choose not to. Now, from my own perspective, one of my many lifetimes ago, one of my careers back in the 70s, early 80s, is I worked in residential and day programs for people with very severe and profound developmental disabilities, and actually some even into the 90s a little bit. And I did a lot of non-verbal type of hypnosis, relaxation, mindfulness work with people who were blind and deaf and profoundly, severely mentally retarded. A lot of it was done with hands-on and breathing techniques. People that had a lot of severe interest behaviors going on, I taught them how to relax, and taught staff how to, just by touching a shoulder or something or holding a hand, teaching that person how to relax and to breathe and to slow down their breathing. But somebody who is of very high intelligence generally has a very, very easy time learning to use hypnosis. And the other question? Stephen?
Sorry, Roger. Yeah, can you hear me? Sorry, I just muted myself there.
Okay, I don't see the question, so.
No, that's okay. I've got the next question here is from Jennifer. Thank you, Jennifer. And it has to do with PTSD. Have you worked with clients suffering from PTSD?
Yes, I have. And I'm also always somewhat cautious about it and making sure that it's within my scope of practice, and checking on the other therapists or modalities that are involved and before I proceed. Teaching people how to relax, how to manage the stress, the anxiety, how to basically move out of the trance of the post-hypnotic stress, the fear, the panic, the anxiety that they may enter into, and get back in their body and relax and know that in this moment they're safe and they're okay. Mindfulness and hypnosis work very well for that.
Okay. Thank you very much, Roger. We'll have to pull it up there.
My pleasure.
Yeah, no, it's a fantastic presentation, and certainly some great information in there that not only